Welcome back, everyone. We are still talking about the changing face of aging in Erie County, and we've had as our guests Randy Hoak, the current Commissioner of the Senior Services, and Diane Bessel from United Way. And we've learned a little bit about what they've learned from their surveys and their studies and how this is going to impact on services now in Erie County. So I'm going to turn this over to you and just let you say whatever it is that you want to say on how this is going to happen, because it's definitely going to be a new ball game.
Absolutely, and I think the one thing that can get lost in our needs assessments, and when we talk about numbers and we talk about the changing demographics, is that that neither United Way or the Department of Senior Services can do any of this work on our own. We have to do it together. We work very closely with United Way, and we have many community partners that bring this all together. And the information that we glean from these assessments helps us to develop the right relationships to provide these services in the community. So I think when you look at Erie County, you look at Buffalo, things are very different. Things are very different on the west side of Buffalo than they are in rural southern Erie County. So those are some of the differences that we need to take in place, and those are some of the information that we get from these needs assessments as well.
I would like to echo what Randy is saying about relationships. I know that United Way has worked really well with the Department of Senior Services, and what we really try to do is enhance the provision of services that are available to seniors and to their caregivers and the people in their lives. One of the things we've really focused on is how do we improve their results? How do we help them to reach more people and to help more people? And so we've partnered on a project called Second Act over the last few years that was really about how do you improve services to the caregivers and how do you make sure that they're really accountable. You know, the reality is for both of us that the dollars just aren't really there, and so how do we rely?
Funding. Wow. Wow.
It's a real challenge. And so how do you utilize volunteers or help those providers reach a little bit further so that they can serve those needs that are so real in our community? So it's partnerships like ours that can help to build that.
Now, we raised the issue of funding. Everywhere you look, the sequestration, everything, every organization, every group, I don't care what it is, everybody is feeling the pinch. Now, are additional services going to be needed, or are they just going to have to be done differently?
I think the answer is both. That we do need additional services, and they need to be done differently. They need to be done differently in that they need to be done smarter. As I mentioned in the first segment, one of the things that we looked at was health and wellness. So what that translates to in this year of service for the Senior Services Department is a focus on chronic disease self-management programs. This is beyond a fitness class. This is beyond a yoga session. This is an evidence-based 6-week class that is a very rigid program for the person conducting the program. For the folks that attend the program, they get some good information. They get some good information to take care of their chronic illnesses, and it's very beneficial, and it's proven to be beneficial.
Some of my volunteers are taking that at Moot Center, and they spoke very highly of it. They really did. Practical stuff that they can take home and feel that they can do something with. That's wonderful. That's wonderful.
I like that Randy also talked about evidence-based. You know, with United Way dollars, the dollars...
Always evidence-based with United Way, always.
Yes, always evidence-based, because truly the dollars that we have are from the community. They're taken out of people's paychecks, and they're giving towards this, and so we want to make sure that those dollars are spent wisely. So we seek to invest in those programs that are strategically going to help us get the kind of results we want. And so it really is about what are the best practices, what are the things that are going to really help people to improve their lives, to get kinds of outcomes that we want for them. And so that's how we're using the data. We've kind of shaped and shifted how we're investing and doing that a little bit more strategically.
When that whole terminology started, that evidence-based, everybody's, the hair went up on the back of their heads, and everybody was like, "Wow, wow, wow, wow." But if you really realize, if you really analyze it, it makes you work smarter. harder, like you said, Randy. And I don't care what the organization is, what the group is, and if the outcome is that you're able to give those services and do them with the limited money that you're getting and prove that it's worthwhile, you can apply for more, and hopefully you get it. Yeah, that's great.
It makes our programs more effective, more efficient, reach more people.
Right.
I think what organizations like ours have also realized is that we can't do everything for everyone. In some cases, we simply have to know who does these things the best in our community.
Right.
And we know that people are going to come to us for information. So we have to have that information ready and provide it to them.
Right.
But things are changing in the way that we provide information. The days of big health fairs aren't necessarily the most efficient way to provide that information. Older adults are much more tech savvy, and they're much more demanding with the type of information they're looking for.
Right. Randy, we just have a short time left, and coming up, there's a big event, the annual Elder Law Day. Could you speak to that for
Absolutely.
a second?
That's another great opportunity to get some great information for seniors that are looking for help with legal issues, but also health care issues, advice on health insurance. And it's coming up on June 20th. It's going to be at the Adams Mark Hotel.
Different location
Different
this year.
location, yeah. Right off of Route 5 at the base of the Skyway. Free parking for everybody that attends. We ask that you reserve a spot, and that information, I believe we have for you here. There's a telephone number that you can call, and if you reserve a spot, typically we have about 300 or 400 seniors that come, and we have about 24, 25 different workshops that are filled with great information for
And
seniors.
as I understand it, they can even make a reservation and have like 15-minute spot with an attorney.
A free consultation with an attorney, absolutely.
Well, I can't thank you both enough for coming in today. You're both busy people, giving us your time and sharing this information and giving people a ray of hope, because I think the general population knows that the face of aging is changing, and they may be worried about it, but they're in good hands. Thank you again.
Thank you, Rosemary.
Goodbye, everybody. This has been Aging is for Everyone. See you next time.